Hi, Dr. Valorie here. Today I'm going to talk about perimenopause and menopause and hair thinning. No, you're not imagining it. In perimenopause and menopause, it's notorious for having hair shedding, slower growth phases, hair thinning, hair everywhere. And that's because, well, progesterone itself is probably the decline in progesterone is a hallmark of perimenopause. That's one of the first things that you see. And progesterone is really wonderful for balancing or actually blocking and downregulating DHT, dihydrotestosterone. Dihydrotestosterone is what can cause thinning, especially in the temples and the top of the hair and the shedding. So progesterone is excellent for that. So you see that in perimenopause. Now, when you go into menopause and that estrogen drops, because that's part of the hallmark of menopause is that drop in estrogen. Estrogen has a dramatic effect on creating the growth, or what's called the anagen phase. So that's the hair growth phase. So when that estrogen drops, then the hair growth drops as well. And then, like I had mentioned a little bit about that DHT, your estrogen, progesterone have dropped, then that testosterone becomes a leader of the hormonal pack, and that can have an effect on the hair follicles, on that on the growth phase, and then also causes the hair follicle to kind of shrink in diameter. So the hair that's coming out is smaller in diameter, so it feels like your hair is thinner, not to mention the shedding. So there definitely is an issue when it comes to progesterone and estrogen with hair loss. Now, is HRT magic? I think it can be sometimes, but doing HRT can really help with that estrogen and progesterone levels to help with hair loss. But you really want to also kind of put that in with some nutrition, just checking for nutritional deficiencies, checking with nutrition, with lifestyle. Also checking the thyroid is a huge, one of the first things I do with any woman that comes to see me that says they're having hair shedding is checking that thyroid, because when you go through perimenopause and menopause, sometimes that can put a little burden on that thyroid function. So that's what I have to say about perimenopause, menopause, and hair thinning. Thanks for watching.